First, I would like to ask for your permission to use this video for educational purpose on internet.
Yes, you may.
Now, tell me, you had pain and other problems before the surgery. Tell me about them a little.
The pains were restricting me significantly when I was walking. It was the pain primarily was on the top of the left thigh.
And 1 to 10, how bad was that pain?
Pain would be from 8 to 9.
8 to 9. Wow. And how far could you walk?
I could walk at the most 2 city blocks.
Okay. Now, we did try conservative therapy and everything failed and you weren't getting better. Is that correct?
I was not getting better.
Yeah, and when we decided to do a surgery, I'm going to change here and show the image before the surgery, which shows actually you have multi-level disease and what we call scoliosis, and you see that in the films before the surgery, actually in the here in this area, the finding is much worse in the L4, 5, and S1. But we decided to actually approach this 2 level up here in L2, 3, and 4 because these were mostly corresponding to your symptoms. And here we have a cob angled side bending of 27 degree that we now corrected to about 14 degree in this area. And here you see how this is the spacer lifting up the bone and bending it the right way. And we went over the films. Films show that they are significantly corrected in the area we were aiming at. Now, what are your symptoms now? How are you now?
I can walk 3 to 4 blocks with the highest level pain is probably a 2.
A 2, and the surgery just was about a month ago, and so we have a long way to go.
Yes.
Still now. And the pain, you said with some activity up to 2, which is much better than it used to be up to 8 and 9 as it was before.
Significantly better.
Now, how long did you stay in the hospital?
I stayed in the hospital 1 day.
Just over the night. And here is your data from the surgery. Your surgery was done. You stayed 1 night in the hospital. The operative time was 1 hour and 10 minutes, and our blood loss was less than 150 cc. And this is supposed to show that a segmental correction of scoliosis, as we did with you, if we tailor it to the symptoms, can be very effective in treating the symptoms. Especially, I guess it's important that if somebody looks at the picture on the right, naturally he wants to go and fix entire spine from the L1 to S1, because just the way it looked like. But here we are able to show that with the limited surgery, we can achieve significant clinical result. Do you agree that overall the surgery helped you?
Yes.
Excellent. Now, how much of do you think overall your symptoms are gone since the surgery? Just 1 month after the surgery?
80%.
80%. Fantastic. Thank you for the interview.